Hello, please subscribe and like for our channel. Thanks very much.
Now, in this question, we have a 4-year-old girl. Now, in this 4-year-old girl, we say list the two obvious abnormality. Is it clear? So, in this two obvious abnormality, we have deviation of the mouth toward the left side. Is it clear? And we have inability to close the right eye. We have deviation of the mouth toward the left side. We have loss. The two obvious abnormality are deviation of the mouth toward the left side, and we have loss of nasolabial fold on the left side. Is it on the right side? Sorry, deviation of the mouth on the left side, loss of nasolabial fold on the right side. Is it clear? It's not very well seen how she's not closing well her right eye, but if you see very well the right eye and the left eye, you see that the left eye closes more than the right eye. So we have a slight inability to close the right eye. Is it clear? So every time that the mouth deviates, is it clear? Opposite. So in this case, when you have the eye and the first thing that you have to ask yourself the question is there an eye and mouth abnormality for it to be peripheral or central facial nerve palsy? And the answer here is yes. There is both an eye and the mouth abnormality, meaning that it is a peripheral facial nerve palsy. Are you understanding? Now, the next question you ask yourself is, when you have a peripheral facial nerve palsy, the mouth deviates towards which side? The mouth is going to deviate away from the lesion. Are you understanding? So since the mouth here deviates toward the left side and she has a peripheral facial nerve palsy, it means that the lesion is on the right side. So the answer is a right peripheral facial nerve palsy. Is it clear? What's the most likely diagnosis? Right peripheral facial nerve palsy. Now, list among that's the syndrome that you have here. Is it clear? The right peripheral facial nerve palsy. The diagnosis is not actually right peripheral facial nerve palsy, but for short cases, just right peripheral facial nerve palsy. The diagnosis is anything that is capable of causing that palsy. Is it clear? You have things like a mandibular fracture. If you have a mandibular fracture, you have a parotid tumor. You can have a parotid gland tumor that compresses the facial nerve. Is it clear? You have a mandibular fracture in the case of trauma, and you have to also know that the facial nerve come at the level of the internal ear. So an otitis media is capable of causing it, and you can have also facial nerve can be infected as a result of things like a secondary varicella infection. When you have a secondary varicella infection in the case of patients that are immunocompromised, that is called what? It's now called a herpes zoster infection. Is it clear? So when you have herpes zoster, it's also capable of causing that. If you have a trauma at the level of the basal skull, is it clear? Trauma at the level of basal skull is going to be called a Great Turner syndrome. Is it clear? A patient that have a facial nerve palsy as a result of a trauma at the level of the basal skull is called a Great Turner syndrome. But now a patient that has a facial nerve palsy as a result of varicella virus infection is going to be called a Ramsay-Hunt syndrome. Is it clear? So those are the different things that you have to know as the etiology of facial nerve palsy. Now, the next thing is list two important modalities of treatment. The important modalities of treatment here, we have the first one, we have medical measures. Medical measures give artificial tears, and the artificial tears is particularly made up of cellulose. So we prescribe cellulose to the patient, methyl cellulose to the patient. Is it clear? To just make the eye to lubricate. Is it clear? You prescribe artificial tears as medical measures, and then as interventional measure, you prescribe physiotherapy. Is it clear? And if there's a cause underneath the facial nerve palsy, you have to treat that cause. So now let's go to the next question.